Hi, my name is Caroline deWinter, and today I'm going to talk about Alzheimer's disease. On average, those with Alzheimer's disease live for 8 to 10 years after their diagnosis, but this terminal disease can last for as long as 20 years. Alzheimer's disease is the number one leading cause of mental impairment in elderly people. It affects a large percentage of admission to assisted living homes, nursing homes, and other long-term facilities. Psychotic symptoms such as delusions, hallucinations have been reported in large proportions of patients with this disease. There are three stages of this disease, and then the cause, also the treatment, and then finally the function on how it all began. Table of contents. What is Alzheimer's disease? What happens in the brain? The three stages. Medication that can help for each of the stages. The cause of Alzheimer's disease, and conclusion.
What is Alzheimer's disease? Alzheimer's disease is an irreversible, progressive brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest tasks. In most people with the disease, those with the late onset type, symptoms first appear in their mid-60s.
What happens in the brain? In the brain is where the Alzheimer's disease happens. It is a chronic disease known as neurodegenerative disease. What happens in the brain is that there is an accumulation of amyloid plaques between the nerve cells. Then the neurofibrillary tangles are insoluble, twisted fibers that are found inside the brain's nerve cell. The main protein called tau, which then forms a part of a structure called microtubule. The microtubule transports important substances and nutrients to one side of the nerve cell to the other side of the nerve cell. Axon conduct nerve impulses away from the nerve cells. They are long and thread-like. Dendrites are also long and thread-like, but they are not long, they are short. Dendrites also conduct nerve impulses, but this time they are towards the nerve cell instead of away from them. A person with Alzheimer's disease, their tau protein is abnormal, their microtubular structure is collapsed. As the disease progresses, the brain tissue shrinks. However, the ventricle chambers in the brain which contain cerebrospinal fluid become enlarged.
There are three stages in Alzheimer's disease. The earliest stage of Alzheimer's disease is called mild disease. Mild disease may begin 20 years or more before their diagnosis. Medical tests cannot yet detect Alzheimer's disease in its earliest stages. The next stage is called moderate Alzheimer's disease, also referred to middle stage. The middle stage is typically the longest stage and can last for years. In this stage, doctors can actually diagnose the person with this disease, and families and friends begin to notice it a lot more, and it's very apparent to them. And the final stage, severe Alzheimer's disease, another word it is used as is late stage. In the final stage, this disease, dementia symptoms are severe. At this stage, the person may need round-clock assistance with daily activities and personal care, loss of awareness of recent experiences as well as their surroundings. While there is no cure for Alzheimer's disease, but there are medications for some of the stages and the emotional and physical part the person may be going through at the time that could help them. We now have so many different types of medications for memory loss. The drugs cannot cure the disease or stop it from progressing, but it may help with memory loss and confusion for a limited time. They have different medication for each of the three stages for the memory. For the first stage, they use a drug called cholinesterase inhibitors. This drug is approved to treat symptoms related to memory, thinking, language, judgment, and other thought process. The three cholesterol inhibitors are commonly prescribed. Donepezil Aricept is for all three stages. Rivastigmine Exelon is for mild to moderate stage. Galligantime Radazin is for mild to moderate. Also, more medications to severe include memetine. Memetine is used to treat memory, attention, reason, language, and the ability to do simple tasks.
The cause of Alzheimer's disease. The cause of Alzheimer's disease is caused by a combination of genetic lifestyles and environmental factors that affect the brain over time. The risk factor among genetics of developing Alzheimer's disease is higher risk if the one who has the disease is a close relative like your parent or your sibling. Most genetic mechanisms among Alzheimer's disease remain largely unexplained, and the factors are very complex. The better understood component of it is the genetic factors forms of apolipoprotein E gene APOE. The variation of the gene APOE E4 increases the risk of Alzheimer's disease, but not everyone with the variation of the gene develops the disease. Also, scientists have discovered a rare change in 3 genes that virtually guarantee a person who inherits one of them will develop Alzheimer's disease, but the mutations account for less than 1% of people with Alzheimer's disease.
Alzheimer's is the most common cause of dementia, a general term for memory loss and other cognitive abilities, serious enough to interfere with daily life. The disease has been killing millions of people and there is still no cure. Some doctors even think that technology could be one of the causes today.